All right. Good afternoon. I always want to say good morning. Good afternoon. Thank you for joining us at home for this month's edition of our monthly Lunch and Learn at Maryland Crime Victims Resource Center. Every month, we try to share a topic that we think would be helpful to somebody out there, or maybe someone that you know might be experiencing some issues with the elderly people in their families or around them. So if you would like to share this, we would appreciate it. Just making people aware of what their rights are, what things that are going on, and other resources that are available. And this month we are tackling elderly care, which is such a huge topic. There are so many different aspects of this topic. So we're going to hop in. Today joining us is Joanna Mupanduki, our Deputy Director, Paula Diamond from Care Patrol, and Kathleen Callan, who is an attorney with Maryland Crime Victims Resource Center. I'm going to do a quick round robin where you guys can announce yourselves, and then we'll hop right into some questions. Joanna?
Hi, my name is Joanna Mupanduki. I'm the Deputy Director here at Maryland Crime Victims Resource Center. I've been an attorney for 18 years now, and mostly been a prosecutor. Before I came to Maryland Crime Victims Resource Center, I was also an attorney out in a government job working for the Department of State Hospitals in California for a while. So that was a lot of fun, where we helped represent the hospitals out there for psychiatric patients. And so that was my background before I started helping represent victims and litigating on behalf of victims' rights. So I've very much enjoyed that, helping victims. There's nothing better than standing up and being a voice for those who really have very little voice in the legal system.
Thanks so much, Joanna. Paula?
Good afternoon, everybody. My name is Paula Diamond, and I am the Director of Marketing for Care Patrol Baltimore. I've been with Care Patrol a little bit greater than a year, but I have been in healthcare for almost 40 years. So I've really have focused on the elderly with Care Patrol of Baltimore. It's an incredible company that is a local Maryland company that is also represents the entire country with over 220 offices throughout the United States. We take care of elderly patients and trying to work with them and find the right match for assisted living, memory care, independent living, to keep everybody safe and out of harm's way.
Thanks so much, Paula. And I can't wait to introduce that to the people at home in this episode. So, and then Kathleen.
Hi, everybody. Kathleen Callan. I'm an attorney at Maryland Crime Victims Resource Center. I've been an attorney for 35 years. Early in my practice, I ran a pro bono program, and part of which was elder services, elder legal services through the Department of Area Agency on Aging. So we did a lot of, informative speaking engagements, help people with wills and powers of attorney, talk to people about whether it's a good idea to put your house and your children's names, and sharing bank accounts with your children, that kind of thing. I have a lot of experience talking with people like that. And I did some other, mostly civil work, until I joined Maryland Crime Victims Resource Center about 6.5 years ago. Now I represent victims on the Eastern Shore in 7 counties. It's a very rewarding job, because my clients are for the first time involved with the court system, and they don't know what's up and what's down. And so it's very gratifying to be able to explain things to them, and be there with them, so that they don't feel alone and wondering what's going on. The state's attorneys in general do an excellent job representing the state and prosecuting the crimes that our clients are victims of, but often don't really have the time to repeat over and over what's going on, answering the same question over and over, because when you're in trauma, it's difficult for your brain to hold on to information. So it's an excellent job. I really like it, and I'm glad to be here today.
Thanks so much, Kathleen. I'm sure that you are a wealth of knowledge on the topics that we're going to discuss. And so I was lucky enough to meet Paula at one of a chamber event that we're both a part of. Well, MCVRC is a part of, and Care Patrol is a part of. And she was, my neighbor sitting next to me, and so we get to chat, and it was just like a perfect place to kind of introduce their organization to our followers. And so when I brought this topic up, I spoke to Joanna, and Joanna shared some experiences with dealing with assisted living, which I think that many of us who have parents or grandparents that are aging, we're lucky enough that they get to the point where they need help. I mean, at least they have the longevity of doing that. But then at the same time, it takes a heavy toll, and it is very challenging to maneuver what resources are available for these people. Joanna, did you want to share a little bit about that before we let Paula discuss the things that they do?
Just briefly, that both my grandmothers had ended up in assisted living, and one, we had to use up what little resources she had to be able to get her care paid for, and then my other grandmother had no one else thought that she needed the long-term care insurance when it first came out. I believe it was in the late 90s, early 2000s, and she thought it was a great idea, and all of her children were like, no, why would you need that, Mom? And but she bought it, and yes, indeed, she did need it, and it was really the best purchase she had made, and it was at a time when it was very cheap for her to get it at that time, and so she certainly was able to then afford much better care because of that, and a better assisted living facility, because she did have the resources then because of that insurance at that time. So it was a very different experiences with both my grandmothers in those situations, and those are probably about 15 to 20 years apart as well, and in different states. So very, very different experiences with both, but really very eye-opening when you're like, wow, it's very different situations depending how people have planned and how they have prepared.
Yeah, for sure. And I think that I had similar experiences with my father. He was military, and so I just thought, oh, well, this should be easy. Like, we're just going to go to one of those military, veteran home things. Oh, yeah. That's not how that worked at all. That's not how that worked. And he had the added complication of being on dialysis. So it was trying to maneuver the system and not really knowing that there were guides out there to help us. And so we're just going to let Paula kind of discuss what Care Patrol does, because I think it's really an interesting resource, and I feel like it's a hidden resource for Maryland. So Paula, jump right in. Tell us what you do.
Thank you so much, and thanks for the privilege really to be here and discuss Care Patrol with everybody. Care Patrol Baltimore, as I had mentioned, is one of 220 in the country. It's a franchise. We cover Baltimore City and Baltimore County. We represent 40 rehab centers, about 400 licensed assisted living, and 9 hospitals. So we talk to the social workers at the hospitals. We talk to the case managers at the hospitals. We work with doctors in their doctor's office who identify that one of their patients needs assisted living. It's no longer safe for them to be at home by themselves, or they have particular disease states, whether it's dementia or Alzheimer's, that it's a change of how they lived before and lived independently or with their spouse. What makes Care Patrol very, very unique in the marketplace is that we offer our services with no cost to the families. So we are paid by the communities that the family picks. So we do a very in-depth assessment and an evaluation. We take a look at what the interests are socially, emotionally, the medical needs of the patient. We actually go to assess them in person wherever they are. If they're in the emergency department or they're at their home still and are hanging on to still being home, or they're in the hospital or they're in a rehab center, it doesn't matter where they are. One of our specialists will come and assess them, make that determination, what's the best match, and then provide the families about 3 to 5 choices based on where the family loved ones want their family member to live. Say they are in Southern Maryland, or they're in Howard County or Hartford County or Columbia, Maryland, or Baltimore City or Baltimore, wherever that location is. We then match up how much the family could afford, because as many of you know that are listening, assisted living is a private pay. And we know that people have so much resources that come in each month, or have savings if they have the privilege to have a long-term care plan. It's not the norm today that we see that much, because it has become so expensive to maintain. But with that being said, we make the match. I call it a marriage between what the needs are of the patient today, what we anticipate their needs to be in the future, and what is the best environment for that patient, not only today, but in the future. Where are they going to thrive? Because once you settle in and you find a community that works, you don't want to have to move your family or loved one by choice, because it's unsettling. It's an adjustment. But what we do is, by working the way we do, the Care Patrol of Baltimore has been in Baltimore for 11 years. So the company itself is 30 years old. But Care Patrol Baltimore has been here about 11 years. We've helped about 2,000 people find a community, which is pretty impressive. And every community is different based on what it offers, whether it's a large community that's a rental, if it's a continual care community environment, or it's going to be a residential assisted living. And that might be a house that has maybe 3 to 15 people that live in a house. Sandra and I were talking about that when we first chatted. A lot of people have residential assisted living. The ratio of caregiver to patient and loved ones is so great, and it's an amazing value for the type of care, the type of love. And of course, people have their medicine managed. They get 3 meals that are custom for whatever their dietary interests are. And in your situation, Sandra, you talked about that your dad was on dialysis. He was on a special diet. Because of dialysis, you have to be careful of certain things. So our assisted living are very familiar with that. And we would only direct a family to an assisted living that could really meet the medical and social and emotional needs of their loved one. So we've been doing this throughout Baltimore for the last 11 years, as I had mentioned. We work with the families on every single step of the process, from evaluating and assessing them to then working with the patient, working with the families. And then also we need to ask certain questions, and certain paperwork, frankly, has to be filled out. So there's things called a MOST. There's something called an HCP. These are all medical forms that help really pave the way for what type of facility, community will best meet the needs. That's a little bit of an overview. We tour personally with all the families. We order all the equipment that's needed, whether it's going to be a hospital bed that's in one of the assisted living, whatever are the needs of the patient, to make sure that their adjustment is right. Then we follow up. So we not only work with families before finding a community, while they're still in a community, and months later after because we want to make sure that we did the right match, that the marriage is a successful marriage.
So when you say you work with Baltimore, is it just that the patients are currently in Baltimore, and then you can work with facilities that are in other parts of the state?
Your question is a great one. Because Care Patrol in general is a national company, we happen to have the franchise for Baltimore City and Baltimore County, but we're all on the same platform. all 220 care patrols that are throughout the country. So we focus on Baltimore City and Baltimore County, but we work with all the care patrols in the state of Maryland. We also work with care patrol in Colorado. We work with care patrols in Florida. So it depends on where the loved one is. Somebody comes to visit their family and they get sick, but they want to go back to New Hampshire. We make sure that we hand deliver that process because we're really experienced in this space. And our company is actually run by a nurse, and everybody that's on the team are all certified. They're all in the space with elders. They understand. One of the stories that Sandra had asked me to tell, and I think it's a great opportunity just to discuss it now, is I was making a comment. My own mom is actually in assisted living, and that's how I organically came to this job, coming from a very different part of healthcare for most of my working years. And I made the comment, gosh, the folks here are really so much younger than my mom is. The executive director shared with me, she said, well, Paula, you have to understand the journey of a lot of the patients, clients here. Some people had elder abuse and lost all of their money. They had been scammed. There's a lot of things that happen to people when they pick up the phone and they think it's their family member. They think it's the person from the bank, and they proceed to share so much confidential information. And it ends up being somebody who has anything other than good deeds in mind. So the goal for us with Care Patrol is to help anyone in that space that can afford it. So in Baltimore City, just information for everybody, we start at about $2,500. We don't set the price. It's those licensed facilities and communities that meet all of our standards, and every single one of the assisted living that we recommend are all vetted out by our director. She has been in every single one of those communities. And because we're in and out of these communities every single week, we know if quality is not what it used to be, we then pull back. We recalculate those recommendations. Baltimore City is $2,500. In the county, it's about $3,500 per month. So it is a difference between city and county. And then certain counties like Montgomery County might be more expensive because other things are more expensive in those areas. But money should never be an issue initially for reaching out to us. We'll be able to help you and vet and give the best recommendations. We will never leave anybody and say, sorry, we can't help. We'll give other referrals. We'll provide information with Medicaid. We'll provide every resource we possibly can, because we look at everybody who comes our way that there's a need.
It's like you're hitting all the questions that I was going to bring up, like what are the other resources and all those things. You hit them all.
I keep
and then
asking.
we did talk about the special needs community as well.
Yes. So it's a very evolving area. Sandra was asking me about group homes. So group homes tend to be more Medicaid focused, and that's not necessarily within our purview, although we do know and we can refer, but it's not within our actual core business. So what we do find is that special needs folks who are aging through the system, we'll find them with private pay to be in an assisted living. And there may be other younger people just like they. We're very careful where we will recommend people to find a community, because you don't want very elderly people with a very younger person who they need to have a buddy. They need to have a friend. And we're very sensitive to that. In general, assisted living is for older, more senior folks, but there's a change. I mean, the system of healthcare has changed. The system of special needs has changed. So we're starting to see much more of an expansion of those as well.
Yeah, thanks so much, Paula.
You're welcome.
And
You're welcome.
the conversation and the reason why the special needs community came up is that I used to have, back a billion years ago, I had a coworker who had a special needs sister, and their parents were they were aging, and the sister had Down syndrome, and so she was relatively independent in that she could ride the bus, and she held a job, and so they wanted to transition her before they passed. They wanted to make sure that things were set up. She knew how to ride the bus from there. She was comfortable, and it just wasn't such an aggressive change, like if something were to happen to one of them. And so that's why that question had came into mind, because there's just so many different realities for so many different folks. But what Paula was talking about was, people safeguarding their loved ones in a facility because they are getting bamboozled by these fraud schemes. And Lord knows, people that just do not have the best interests of that person in mind. And these stories, I always used to hear them from Kathleen. There's a couple of other attorneys where they're like, there's this case where this person, I don't know, mail me 500,000 dineros. Lord knows what the scams or the frauds are. And I think that, and it's tough, because there's such a bridge when it comes to technology, when it comes to so many different things. And our elderly are definitely being targeted for some of those things. And so I wanted to open that up to some of the things that we can do as far as fraud and abuse and things that are going on with the elderly. Kathleen, did you want to share with us some experiences that you've had, and then we can jump into financial and physical abuse?
Sure, I'd be glad to. So like the rest of you, I have some personal experience with scams. One of them was a caller to my husband's father, who lives in Wisconsin. And he got a call from my son telling him he had been arrested and put in jail and he needed bail money. Okay. Well, my son's parents are lawyers. Why would you call your grandfather and say, I need money to get out of jail? Oh, I'm embarrassed. I don't want to tell them what's going on. My son doesn't even have his grandfather's telephone number. They're very frequently in contact. I don't know that my father-in-law would recognize my son's voice. So it was sort of a perfectly bad scam. However, my father-in-law was very upset about the whole thing. And he said, this is not how we do things. This is not how we do things. You need to call your parents. So what is the lawyer's thoughts on that? It's like, how could I prevent that scam? I can't prevent that scam at all. They're playing on people's emotions, worry, who knows what. So that one turned out fine, fortunately. My mother is in a senior, it's not assisted living, it's the whole panoply. You got independent living, you got assisted living, and then you have a memory care unit. So I don't know what that whole thing's called.
Continual Care Retirement Community,
Thank you.
CCRC. Yes.
I'll never
And they're in the country, about 2,000 of them throughout the whole country. And they're a whole continuity of care.
Continuity of care. Well, where my mother stays is like a cruise ship. I mean, it is very wonderful. There's a cafe and a dining hall. A dining room with tablecloths. They have a fitness center with a pool, a workout area. They have a bus that takes them all over the place. It's in Montgomery, Prince George's County in Silver Spring. And it's a fabulous place, it's wonderful. But she'll get emails and she'll call me up. Kathleen, I just got an email. It said, somebody owes me money. I'm like, Mom, nobody owes you any money. And if they did, guess what? your accountant would tell you if they owed you money, or I would. So she's like, oh, okay. What should I do? I said, just delete it. I should delete that. Yes, just delete it. And of course, in my mind, I'm going, oh my God, what if somebody owes her money? But nobody owed her any money. So as a lawyer, how do you prevent that? I can't prevent that. The only thing you can do is have a very good relationship with your parents or whomever you're worried about, and just try to warn them about scams. And just say, if it's, my father also was a lawyer, and I don't know how old I was when he first started saying to me, caveat emptor, let the buyer beware. If it sounds too good to be true, it probably is. So I've always been a fairly cautious person because he said that to me my whole life. So that's what I would say to anybody listening is, be careful, be aware. If it sounds too good to be true, it is. Another thing you can do is if you are getting an email from somebody. I mean, this happens to all of us. We get emails. I got an email saying, "Oh, you can pay your car registration. You have one more year left on your car registration, but you know what? You can pay it in advance if you want." I'm like, why in the world would I want to do that? And in my mind, I'm just sitting there thinking, this does not make any sense. And I just got busy and didn't think about it. And then after a while, I was like, you know what? That was probably a scam.
But it's so true, though, Kathleen. I
Yeah.
tell you, and when we talk about the elderly being scammed, I'm telling you that my son was looking for jobs last year, and he thought he got a job with UPS. They were messaging him, trying to get all this personal info, and I'm like, wait a second, hold on, they just hired you over text, it didn't make sense to me. What is the local office? What is the they're calling you from Lord knows where, and the website that they sent looked exactly they're so good at trying to fraud people. It looked like a UPS website. It was the brown and the brown and the yellow. I mean, really, who does that? And it was the website
very
was
convincing.
ups.hiring.something.com, but it had UPS in the title, and it can be young people. It could be us sitting here, middle-aged people. Just everybody.
So, and I think your comments are so spot on, unrelated to Care Patrol, but to life. Every email, and this is to everybody listening, they should always, before they act on an email, before they act on a request that's on a text message, check out the email list. Just check it out, because you will see that it's not .gov, and it's somebody's personal phone number, and they're asking you for confidential information. And I think that my adage is like your dad, Kathleen, is that if something is way too good to be true and it sounds so amazing, it's a scam. And it's a shame that you should feel that way. And when we put ourselves in the shoes of our older parents and the older adults who are very trusting, they want to see the good in everybody, not see people as being disingenuous and untrustworthy, that people want to believe in the good. The issue is that you almost have to shake people and say, please don't do anything. Please verify with us. And when the assisted living executive director said to me, this is why we need to provide safety nets, and we are the safety net. And it's incredible in my mind to think that that's what it is. But you need to have somebody else, and you wonder why a lot of the communities where the seniors live don't have direct phone numbers into the apartments that our loved ones are living in, because there is a way at the front desk to figure out, and they really review every call that comes in, because they're afraid that the members of their community are going to be taken advantage of. So they're like the safeguard, the guards. There's a reason for it, unfortunately, but this is the world we're living in.
So, Sandra, I have a couple of tips for everybody.
Yeah.
One of them I learned a couple years ago. The FBI I think it was the FBI, was having a training I was fortunate enough to go to. And it was attended by police, FBI agents. I mean, all kinds of, people on the front lines of crime and things like that. But one of the things they recommended was to freeze your credit. So all you need to do is Google freeze my credit, and then you can freeze all your credit accounts. And what does that do? It doesn't do anything other than not allow anybody to, if they have your personal information, apply for credit in your name. And then if you want to unfreeze your credit, Google unfreeze my credit.
For young people?
Anybody.
Okay, because I heard of like people using like infant social security numbers for credit and stuff.
You do freeze your credit.
Okay.
You can unfreeze it. After that conference, I froze my credit, and then I applied for a home equity loan or some kind of, maybe it's a mortgage. I don't remember. Anyway, the broker said, "Hey, your credit's frozen. Can you unfreeze it?" I'm like, "Oh, I forgot." Okay, and then I unfroze it.
Hey, that worked.
It worked. So all you need to do is make sure you have your password somewhere.
Oh.
Don't lose your password.
Like, I'm gonna make it a really good one.
then you can unfreeze it. They also, one of the agents there recommended an app that is like a password app, and I forget what it's called. You lock it, or I don't know, something. And I tried that for a little while. It just really didn't work for me. But other people, I think, you might investigate something like that to help, your password from being stolen from somebody. Every year you have a right to check your credit for free. There's 3 credit reporting agencies: Equifax, Experian, and TransUnion, and you can check with them for free. And the reason you do that is you want to look at, what credit cards do I have? Maybe you have cards you forgot about. I hope not, but you might. You could close them out. You might see somebody who you might see something you don't recognize at all. What the heck is that? Who did somebody take a card out in my name? And you wouldn't know because they could change the address to theirs, and they're not going to pay it or whatever. You're not going to get the bill or whatever, and you're going to see on there of this charge. Another personal experience: my mother's credit was stolen, and it was a pain in the neck. Even with her husband being an attorney, unravel that, untangle it all, it was horrible. So you really should pay attention to your credit. And of course, everybody probably knows this already. If you feel like there's been some breach, make sure you contact your bank and contact your credit card companies and make sure that they know about it. And it used to be my credit card company used to call me on the phone. I mean, they really did call me. They were in Maine, and they're like, "Kathleen, did you order this thing for whatever?" And I'm like, yeah. Okay, we're just checking.
Oh yeah. Especially if it's something out of your norm. It's not the grocery store. Like, "Kathleen, did you buy this $1,200 item?"
Right.
Thanks for checking on me. Yep, got a new dining room table. Like,
so I don't think they do that anymore. I don't think credit card companies generally.
Ours gets frozen. My husband and eyes get frozen all the time. It's ridiculous. Yeah. I'm like, I get it. Like, we're living our life today, just today.
So those are some things that you can do. And I want to tell anybody listening, if you feel like you have been scammed, there's lots of romance scams because they prey on your emotions, and a lot of people are lonely, as we all know. And they make all these kind of promises, things, and then all of a sudden they just need a couple dollars here and there, and then they need a couple more dollars here and there.
I'm a big fan of that reality show.
Oh well, I don't know about it, but if you feel like you're in trouble in that way, please call Maryland Crime Victims Resource Center. We have attorneys in every county in Baltimore City, and we are very happy to help you.
Yeah, those are great tips. I think those are great tips. And, for freezing credit, that can work for your loved person that is elderly or has dementia, has some memory issues or what have you. I think a lot of those things happen when someone starts, you have their power of attorney now. Let's start doing these things and safeguarding so that it's just not a messy situation to go through. So financial abuse is definitely one thing that comes to light with the elderly, where people are using their amazing credit because they were very careful with their credit while they were living their lives, and they had the same old raggedy car for 25 years, and their credit's amazing, and they never lived outside of their means. And then Auntie Joe decides to use that information and use that credit and do all these funky things. So that's when theft, that was fraud. We talked about fraud, but there's also theft when it's people that right? It's loved ones that have access to your loved person. What are some of the things where that it's going on? Grandma's credit got used by Auntie, and Auntie went on a shopping spree and went on vacation on Grandma's credit, or had her buy a car or whatever. What are some things that you can do to safeguard it after the fact? Are there things that can happen? I mean, it sounds really sloppy, but I do feel like we're kind of the real life, yuckies.
Here's the real life situation.
Yeah.
The grandma's lonely, and the nephew, who she never saw her whole life, is paying attention to her. Oh, Grandma, can I have your Sears card? I need to go. Is Sears still a thing? I need your Sears card. This is a real case. Can I have your Sears card? And you go out and buy a whole bunch of stuff. So I found out about it somehow. I don't know if another caregiver called, and I went and met with the woman, and she didn't want to prosecute. No, that's my nephew. It's family. That's the reality of what happens. The safeguards are what I've already said. First of all, with any credit card, you have when you get your statement, you have 30 days to object to any charges on the card that you did not make. You have to do it in writing. Look on the back. You don't get a credit card statement anymore, but you can go online and look at it, and it will tell you what your rights are. You need to follow those rights, or what else? You could call us, and we could tell you what to do.
Yeah. So they have to be willing to kind of go through the process of. Now that's the major thing, unless someone else has a power of attorney for their affairs, right?
No.
No.
Power of attorney doesn't give you authority over the person.
I mean, over their affairs.
Doesn't matter. I mean, they still have a right to make determinations about what should happen.
Yeah. Interesting. Very interesting. Okay. So there's that. Physical abuse. Who wants to dive into that? Physical abuse of elderly people, whether they're at a home or in a facility.
Well, I'll talk about
it. Some resources that we're going to share online as well.
The first thing you do is you can call Department of Social Services, Adult Protective Services, or you can call the police. I'll let Paula talk about what to do if you're in a facility, because I know she knows what to do.
So there's a couple things. Thanks so much, Kathleen. So there's a couple recommendations. One is the Department of Aging is very, very important and a very key partner. If somebody is in a community and they are not happy with what's happening in that particular community, there is an Office of Healthcare Quality that monitors the entire state of every single community, and that is an important phone call. They're located in Columbia, Maryland. It's very easy to Google, but it is a very, very important office, and that keeps the finger on the pulse of the assisted living. I think in the state of Maryland right now, there's 698 assisted living. Care Patrol works with about 400 of those that are licensed. And of those that are sort of personal pick, it's probably about 200-ish that will meet the needs. But again, if you are worried about if your loved one is in a community, it's the Department of Aging and also the Office of Healthcare Quality should be contacted.
Okay. So we can help with any criminal things, right? So if people were to call the police because there was elderly abuse, once they have a case number, we can assist them.
Well, yes, and we can also help if they're not sure how to report charges or file charges, anything like that. We can assist with that as well. But if there is also a ongoing criminal case, we can help, of course, with that as well, because we represent victims in the criminal case.
Okay. I know that we wanted to share this. I'm going to add this too. Joanna, do you want to speak to these slides?
Yes, so this is for if there's physical, psychological neglect. So of course, if if the adult's in imminent danger, you found your loved one, call 911, report it just like you would any other crime. You can certainly do that. You can also, if you're seeing ongoing signs of neglect, abuse, you can also call the Department of Social Services, the Adult Protection Division, and you can go to the website here for dhs.maryland.gov to find the local and go local offices to find that. And then if you are suspecting fraud, there's a hotline that you can find local resources as well.
Okay. And I did drop a link to the Office of Healthcare Quality that Paula mentioned. So that is in the chat for those of you at home if you need those. I'll give this slide one more second. If you guys need these, you definitely can comment at any time, even if it's not live, and we'll respond back with any info if you don't grab them here. And then here's this slide of different organizations.
Yes, so then these are particular, if it's mail theft, identity theft, tax related. So if it's taxes, state taxes versus federal taxes, there are different places to report that to, insurance, business related scams, all of that. But you can also call, speak with us, and we can help walk you through this process. But we wanted to put this on the screen so that you can see it and get those phone numbers if you are a person who likes to see things in front of you and to have that information at your fingertips.
All right. I'm just going to give this another second or two. I feel like there's a lot of words on here. All right. All right. I think that's all that we had for today. Is there anything that I missed or that we missed as a whole that you guys wanted to share?
So what I will share with you, Sandra, and we can include that as a document as well, is how to contact Care Patrol, and we then can direct it wherever it is. I will share that there's a phone number to call, which is 410-844-0800. And I can give you the email so that the email address for carepatrolbaltimore.com as well, but I'll send it to you so that you have the link. If anybody needs to talk to us or ask questions, somebody mans our phone number 7 days a week. So we're always available because people end up needing emergency help 7 days a week, and it's not 9 to 5. And we realize that.
Let me drop those in the comments here.
Paula, I had a question for you. If you mentioned, some numbers like 2,500, 3,500, maybe 4,000, or even nursing homes are 10, 12,000 a month. I know that. And I'm guessing, maybe I'm wrong about this, most of your clientele are paying out of pocket for their care. So let's say somebody miraculously finds a place at 2,500 a month, which seems very reasonable. How much more than that do they need? I mean, they're gonna need to get their hair cut. They're gonna, I don't know, they probably want to buy birthday cards for people, or I don't know, whatever.
Yes. Yeah. Kathleen, I think your questions are spot on. So what we find, what really determines the level of the total cost of care for somebody going into a senior community is really their level of care. The state of Maryland has dictated 3 separate levels of care, and those levels of care are associated with an additional cost based upon the fact that you need more help by caregivers if somebody is more incapacitated, if they have Alzheimer's, or if there's aggressive behavior issues from dementia. So how much extra? So what we find in the Baltimore City area, that if we say about 2,500, depending how expensive your personal need products are, if you're using, I'll say generically a Depend, a senior undergarment, because of incontinence or mild incontinence or more moderate incontinence. If you need shampoo and conditioner, if your food is always taken care of in assisted living, if you want cookies, if you want things that are extra, that's always part of the meals. Medicine adds cost, personal products adds cost. And if somebody has supplemental insurance, so they have Medicare, but if they have a secondary insurance, whether it's Aetna or Cigna or it's Blue Cross and Blue Shield, that may be a couple hundred extra. A lot of people have managed Medicare these days, which is a one solid insurance. So we really find about maybe $250 extra to $500 extra, depending on what the patient needs themselves and what their physical needs are. If somebody is going to dialysis, you know what I'm saying. So that's sort of a base, but your level of care can add additional costs depending upon how much help you need. Most people go into assisted living, Kathleen, today at a level 2, meaning they need help with 2 or more ADLs, so their individual ability to do daily activities of life. So they also may have mild incontinence. They need maybe a little bit more prompting for things, and that's the usual. So about a level 2, and that could be maybe an extra $200 a month. But that's sort of a base, but it really would be, let us see your loved one. We'll give you a determination where you want to live, what kind of funds. And what I didn't mention, which I think is very, very important, there is some additional support from our government for people who are military. So there's something called VA Aid and Attendance. It's an amazing resource. If your loved one was in the military and the spouse was with them at the time of their death, the spouse will then qualify for additional support from the government, from the VA, and it only goes into effect, this particular aid and dependent goes into effect if somebody goes into assisted living. So there's companies out there that are helping people fill out all the paperwork. There is a cost, but if you're savvy enough, you go onto the website, we can help. I have resources for all of that. There's also, as you had mentioned, insurance where you have long-term care insurance. Again, it's not the norm that we see, but there's a lot of people who are World War II vets or Vietnam vets who are now aging in the system and finding out that they qualify and their spouse qualifies for an additional VA Aid and Attendance grant every month. It's fabulous. For the vet themselves, it could be $2,400, $2,500. For the spouse, an additional $1,200 to $1,300 every month. So it's an amazing resource from the government that a lot of people don't know about. To me, it's the hidden government secret, but we do everything to help people find those resources that they need to. And you were asking me about our website is carepatrolbaltimore.com as well.
So when a person comes to see you, you review their finances because you have to know what they can afford, right?
That's exactly right. And we really determined, we deal with a lot of situations, just like everybody does, where there's family dynamics. So a lot. So we work with that. We try to really understand what they have in their bank account, what they can afford, because you would never want to put somebody in a situation to make a commitment to a community that they can't really afford to stay in. So it's based on where you want to live, what their health level of care will be. So it's really, I said to you when we started, it's a marriage. It's a marriage. It's really putting all the pieces of the puzzle together to make the best recommendations for the family. And then we tour, we go to every single one of those facilities with the family because we want to be part of the solution and be able to answer any questions that they might have.
Thank you so much. I'd never heard of Paw Patrol. Or Paw Patrol. Sandra, that was you.
I swear.
You did that to me. Care Patrol. My apologies.
It
But
is.
anyway.
It's an amazing company, and I found that out by need myself. So
Thank you.
they do great things for no cost to the family, and I think you're enough in a spin and an emotional where you're just overwhelmed by things that you have to make such a big change that we help, and that's the goal.
Yeah, thank you so much for that.
Welcome.
And I think that, very similarly, you find yourself in need of resources, and here we all are. So thank you for joining us today. Before we leave off, I just wanted to give you guys any last comments. Joanna?
No, thank you. This was a really great conversation. I think a topic that most people have experience with. And if you don't have the experience yet, you will have the experience with. I mean, we all have loved ones and, we're all getting older. So thank you. Thank you, Paula. And thank you, Kathleen, for sharing your experience and your wisdom. So it was a great discussion.
Paula?
I just want to say thank you to everybody. We're here to help. Our loved ones are aging, the world is aging, and we want to make sure that wherever they age and however they age, that they're in a safe environment and happy, because it's all about quality of life. You can get older, but you need to be in an environment in which you thrive. And that's what it's all about. Thank you.
Thanks so much, Paula. And Paula's contact info is in the chat. If you guys need us, just go ahead and message and we'll make sure to share that as well. Kathleen?
Thank you. I'm glad to have another resource that I can refer friends, family, and clients. But the last words for me are, if you're not sure, just maybe ask somebody to look something over for you. Make sure it's legitimate. Talk with your family members. Be in a close communication with them, because that's how you find out things that are happening. You're not going to find out. You hate to find out when it's too late. So try to, be in communication with people, see how they're doing, and then call Maryland Crime Victims Resource Center if you're having a problem. We'll be glad to try to help you sort it out.
Thanks so much, Kathleen. I definitely enjoyed this conversation. I think that it will be very useful for so many people at home you're just trying to live this life and trying to do the best thing that you can. And there's people out there to help you in all different venues, being a victim of crime or something kind of crazy happens. Like, there's professionals that do that. So, let them guide you, and free resources are always the best resources. They always try to help, put you in the right direction. And for that, I'm always so thankful. And I'm hoping that this helps someone out there. If this is not pertinent to you, thanks for watching anyway. Go ahead and share it. You don't know who you're going to help out there. Somebody is living a personal dramatic soap opera right now and really might need this resource. And if you have questions about fraud, abuse, any type of exploitation, criminal matters, please feel free to reach out to Maryland Crime Victims Resource Center. I did drop our website in the chat box. It's mdcrimevictims.org. MD for Maryland Crime Victims with an S.org. And it's 877-VICTIM-1, but I do have it actually with just numbers because it's always hard to spell the words on your phone when you're trying to call. So it's 877-842-8461 or 877-VICTIM-1. Tune in next time. I don't know what we're talking about. We'll figure it out later. We're flying by the seat of our pants here, but super happy to provide this particular lunch and learn today. And feel free to reach out if you guys need anything at home. We service all of Maryland, and we might know a few things. So thanks so much.
Wonderful day. Thank you.
Thanks, ladies.